welcome to another edition of MOSAIC An African American Perspective. I'm your host, Deborah Milo. My guests today are Heather Ross with Montgomery County's African American Health Program and Jeanne Charleston, Director and Founder of Health Freedom Incorporated. Today we're talking about the African American Health Freedom Walk, a fitness journey through Maryland's Underground Railroad. Ladies, thank you so much for joining me today.
Thank you.
Jeanne, we're going to start with you. What exactly is the African American Freedom Walk?
Well, it's a year-long program where I've tied in the history of the Underground Railroad and health. It was about 12 years ago that I'm a registered nurse, and I volunteer out in the community and doing health education classes. And one night I taught a class for a group of people who had diabetes. And there was one woman in the class, she had diabetes, high blood pressure, and high cholesterol. And she just talked about how hard it was living with these three chronic diseases and how her doctor had recommended that she do some type of physical activity, her diet. And I went home that night. I couldn't go to sleep. I tossed, I turned. I kept thinking about her, I thought about myself and others, and I literally cried out and said, God help me. What can I do to just help motivate people? And all of a sudden, I started thinking about people who walked hundreds of miles for freedom.
Right.
So I got out of bed, I did a Google search on Underground Railroad, and I started reading the stories. But what struck me first of all was how people came together to help each other. There were white abolitionists, white Quakers, free blacks who put their own lives on the line to help their fellow man. And I said, thank you, God, that we today are enslaved by our bad health habits.
Absolutely.
Whether it be not exercising or not eating, drugs, alcohol, we're bonded, enslaved by those bad health habits, and that we have to free ourselves. And the best way to do it is to walk. Walking is the best exercise that anybody can get. And it does help with those three chronic diseases that that woman had. And so I told a bunch of friends of mine about the idea I had, and I didn't want it to be a one-day walk.
Right.
I wanted it to be what I call prepare for their journey to wellness. And so what we do is we have a 6-week program where they meet weekly for 6 weeks, and then they go to once a month after that. And the groups are called Circle of Friends.
Okay, okay. So that's how you came up with the idea for the program. I know what it's like to be inspired, or, you know, in the wee hours of the morning, so to speak.
Yeah, we get our best sometimes.
That's right.
Our best ideas.
You're right about that. That's why I have to keep a notebook by my bed table. What are the components of the program? And Heather, I'll ask you this question as well, because I know you with Health and Human Services. Talk a little bit about the African American Health Program and how it partners with about the Freedom Walk.
Well, this year actually marks our 11th year of working with Health Freedom Incorporated. Yes, last year was our 10th year anniversary. And we actually, within the African American Health Program, our focus is reducing health disparities within the Black community. So what we were decided, and I was not there the time that it started 11 years ago, but we partnered with Health Freedom Incorporated to bring this same initiative to the county. We felt as though this was something not only historical, but also it was health related, and this was really geared towards part of what we wanted to do. And a big push and a part of it is the fact that what Jeanne said, it's not just about a one-day thing, it's not just about, but it's about changing a lifestyle. Because one of the things we know is that all the different chronic diseases that we focus on, cancer prevention, diabetes, cardiovascular disease, cholesterol, all those pieces, all the things that we see that are a disparity within our community, actually can be fixed almost, and can be changed or even prevented by easiest thing to do, walking. And not only does the Health Freedom Walk component or health freedom program, not just talk about exercise, but it also incorporates nutrition, incorporates life skills changes and training all into that. And again, it's not just a one-time thing. You start off with 6 weeks, you have your walk, but then you continue to move forward from months on end. And in the 11 years that we've had it, we've had people come back. We have groups that keep coming back, and they continue to move forward. And not only do they then are a part of the Health Freedom Walk in Montgomery County, but then they also become a part of different parts of our programs, including our diabetes, self-management classes. We have cardiovascular disease programs, blood pressure screenings. So it allows us to kind of piggyback and work together with the Health Freedom Walk. And it's just, and the one thing that people don't know is that I've actually, even though I did not know about the Health Freedom Walk 11 years ago here in this county, I knew about Health Freedom Walk through other counties in Maryland. So I knew Jeanne before that.
I've done the program in 11 counties in the state of Maryland.
That's very significant.
So I did Howard County and Harford County, Prince George's County, St. Mary's, Dorchester, where Harriet Tubman was from.
That's right.
Talbot County, where Frederick Douglass is from. Salisbury, Worcester County. So we've done it all over, and so that's how I originally did meet with Heather in another county. But it has spread. We've also I had a middle school in New Jersey that did it for the whole. Middle school did it, and they tied in their health teacher, their history teacher, and the kids had a great time with it. They really did. So my dream is this to be national. That is my ultimate dream. I mean, I've been able to get it here in Maryland, as I said, in 11 counties, but I would just love for it to go national. I would love for it to go national.
Now, you know something, that makes me think, you said something about the children. You know, that's our legacy.
That's right.
That's our legacy.
That's right.
Our parents passed on to us just like their parents passed on to them about certain eating habits. And both of you mentioned something about with regard to how we eat. So that leads me to a double question, if you will. When it begins with the kids, do you see a marked difference of how they're able to communicate this to their families by chance?
Absolutely. Everyone who joins the Circle of Friends receives one of these. It's a training manual.
Okay.
And it's at a 5th grade reading level.
Okay.
And so each week, as Heather said, each week we have, there's a history lesson and there's health and nutrition. And so we do get families and we get the young people. Most of them are teenagers. We get some 11, 12-year-olds, but we get more of the 14, 15, 16-year-olds. And they're just amazed, first of all, of the history. Because, even in school, they learn about Harriet Tubman, they learn about Frederick Douglass, but they didn't learn about Sarah Breedlove, who was a millionaire back in 1867.
That's right.
And so they really are just amazed by that. And then they also, with the nutrition part, in getting their parents to try to start buying more healthier foods. I think about when the seatbelts came in law, and my daughter would say, "Mommy, put on your seatbelt," or kids telling their parents to stop smoking.
That's right.
And so this has had that impact that the children are telling their parents about eating more fruits and vegetables and to getting more fiber in their diet, that they've learned it in the Circle of Friends program.
And we found the same thing. We found that there's some children who were a part of the Circle of Friends last year. We actually had a large Boy Scout group.
Yeah, we did.
Oh, that's great.
They have a badge. The
Yeah.
Boy Scouts and Girl Scouts can get a badge for health freedom.
Yeah.
Oh, that's amazing.
Yeah, we have a badge.
And the kids have now been involved, and we have, I think, the one young man, he's been with it for a while. He's grown up in the Circle of Friends.
We also this year had one of our kids is now a conductor. Our first
one of our
we train our group leaders are called conductors.
Right.
And so the conductors, we have a young lady she's now a freshman in college, and she took my conductor's training here in Montgomery County,
wow.
and she's going to have a Circle of Friends group at school. And so she's kind of grown up with it, and she's going to continue. So that really did make me feel good that
sure it did.
she's continuing it, and our next generation, that legacy
That's right,
piece.
that legacy.
And that's something that I always say, that one of the things with our we do what's called a celebration walk after the weekly 6-week meetings. And that is a way we honor those who have gone. First of all, we honor our ancestors.
Absolutely.
For the legacy that they have left us. And we honor those individuals who are now on their journey to their wellness and their future health, and leaving a legacy of good health to our future generations. And that's what this is really all about, is that we've got to turn it around and to leave that legacy for good health.
Yes, we do. Talk a little bit about the Circle of Friends. When they tell me about the Circle of Friends, how that works.
So with the Circle of Friends, I first start off doing the conductor's training, and we do several different days. The conductor's training, it's a 3-hour. In addition to that, everyone gets CPR certified.
Oh, great. Okay.
That I just want to make sure that if, God forbid, something happens, somebody's out walking, that our conductors would know what to do before 911.
And it is a health program.
Yeah, before 911 gets there. So we do that. And so then they go out and recruit their members of their Circle of Friends. Now, the majority of my Circle of Friends are in churches. That's been my primary venue for the Circle of Friends. But we've gotten work sites.
Yeah,
We've
work
had,
sites. We actually have, I know for a fact, our executive committee, which is an advisory group, they've actually put together their own group, and they says, who wants to join our own Circle of Friends group? We're doing one at our own office building in Colesville, so people who are there. We're looking to have staff who are interested in maybe not joining the Circle of Friends, but being a part on their own and having their own walking groups. We actually met with 2 other groups in the county who do walking groups already, and they're saying, hey, this will be great. We can just add this into what we do. We meet every week, and we'll sign up as a Circle of Friends group and register so that we have our own pieces. So it's really been, even though it started off looking into faith-based groups, it's kind of grown into really the whole community. So it's not just faith-based, but we're looking at agencies, hospital settings. I know a few hospitals here in the county have also asked about Circle of Friends groups, and we're connecting them directly to be able to be a part of that. Senior centers.
I get a lot of senior centers.
Because a lot of senior centers have walking groups. They do walking.
They do.
And
the seniors love the history piece too.
Oh yeah, I'll bet they do.
It does take them back. But I had a family in Baltimore City. It was a mother who had 6 adult children. The mother had diabetes. 5 of her children had diabetes, and 3 were married to men with diabetes, and 2 grandchildren with diabetes. They formed a Circle of Friends.
I want to talk more about that when we come back, because this is just a dynamic piece that we really, really need to talk further about. And I especially want to talk more about the Circle of Friends. For those of you who've just tuned in, you're watching MOSAIC, An African American Perspective. I'm your host, Deborah Milo, and I'm talking to Heather Ross and Jeanne Charleston. After a short break, we'll be back with more about the African American Health Freedom Walk.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities, to ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child. Give.
Advocate.
Volunteer. Live united. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
Welcome back to MOSAIC An African American Perspective. I'm here with Heather Ross and Jeanne Charleston, and we're talking about the African American Health Freedom Walk. You know, ladies, before we went to break, we were talking about the Circle of Friends component of the Freedom Walk. Jeanne, can you kind of pick up where you left off?
Yeah, so I was talking about the family that we had.
Which I still blows my mind.
They were all diabetic. And what ended up happening, well, one of the daughters was the conductor.
Okay.
And several were able to lower their medication, their doses. They lost weight, had improvement, because they also had high blood pressure, some of them, not just diabetes. And one of the grandsons has lost quite a bit of weight. He was actually hypertensive and diabetic from the time he was about 20 years old.
My
and
goodness.
He's had great improvements. So yeah, that's just an example of where we have Circle of Friends. We had a book club that was a Circle of Friends.
Oh, you just got my attention.
And they picked
Love book
books
clubs.
that
Yes.
were tied in. They read a book during the time
that's
about, and I cannot remember the name, Kindred Spirits maybe was the name of the book, but it was, about the time period. We had a Jewish synagogue in Harford County that was a Circle of Friends site.
Oh, that's
So
wonderful.
we've had just a variety of places that have been Circle of Friends. So the way the Circle of Friends works is that everyone gets the manual. This is the training manual. And the big thing in the manual, and this is what really motivates people, is this map that we go from, we're starting in Sandy Springs, Maryland, and we go to St. Catharines, Canada. That's where Harriet Tubman took her people.
That's right.
It's 833 miles one way.
Almost 1,000 miles.
I think
one
that
way.
Harriet did it at least 6 times,
Right.
and most of her trip was on foot.
That's right, because according to the legacy documents, that's what we read, it's about 6 times.
Now, the route that we're going this year, every year I have, as Heather says, we've been doing the program now for 12, 13 years now, but we're going through Ohio, and Ohio had more Underground Railroad stops than any state.
I'm from Ohio originally, so
are you
yes,
really?
I am. So
What
you're right about
part?
that. Columbus, the capital.
Oh my goodness, yeah.
So you're right about that.
We go through Cleveland and we go through Akron. We don't go through Columbus. But anyway, so the way it works is everyone gets a pedometer, okay? And the pedometers I have this year, actually, you tie them onto your shoes.
Oh,
They're not
okay,
the kind you
okay.
clip onto your waist. So you tie it on your shoe and it records the number of steps that you do. Now, you can do it if you don't want to wear the pedometer. You can base your miles on the number of minutes that you actually exercise.
I see.
So if you exercise for 30 minutes, that equals 1.5 miles. If you did 10,000 steps, that equals 5 miles. So you go to the map, and each little circle represents 1 mile.
Okay.
And so the goal is to get to Canada.
Right.
And so what happens with the Circle of Friends is, let's say we're all Circle of Friends, and so I say, where are you? Are you made it to Baltimore? It's 27 miles from Sandy Springs. So, Heather may say, well, I'm in Havre de Grace, which is 34 miles. So it does, especially I find the men, they really like the competition.
I'll
to
bet.
know, like, where you are and how far you've gotten. And it's, the more you walk, of course, the further you're going to get and the closer to Canada that you're going to get.
That's amazing. I love the concept.
Yeah,
Heather,
and it's
you were
not
saying.
just about walking. So if someone
Right.
is a little bit more physically active than others, they then can say the 20 minutes of exercise. So
Right.
if I take say I love step class, so I take a step class,
Okay.
it's 60 minutes, I can make that three
Yeah.
I see.
punches
60
towards
is
that.
3 miles.
Yeah, so I can do that many
So we
minutes.
give them
we
the
do that.
conversion
Yeah.
of
Right.
minutes, and then it gives you the miles.
So
or
it's
the
for
steps.
anyone
So it
at
is.
any activity level, because
Yeah.
the thought process was, of course, when you're never exercised and you're starting or you're starting over, they say the easiest thing is what? Walking.
Walking.
And so, but then what happens when you have individuals who are a little bit more able to do more physical activity or at a different level, they then are able to continue to do this in their own pace. And we find that people like that because even though they meet once a week to walk, they do, but between the times, they do other things. And
Absolutely.
it allows other people to then also look at other things to do. So people may say, oh, I'm starting to walk. Well, when you start to walk, guess what? That means your activity level gets better and you're able to do a little bit more, and you may want to try something new. Maybe I'll try biking. Maybe I'll try cycling. Maybe I'll try, you know, this new thing is the the jumping, the trampoline.
Yeah.
Which is an exercise
for me.
thing, but
Right.
but people do it.
But people
and
do
it's
it,
a
of
way of
course.
staying active.
It
All
is.
we want to do is keep you active and
Right.
get you moving. Start with the stepping.
So what the way that the program is set up is that we've based it on a program the Arthritis Foundation has called Walking with Ease, where for those that have not been exercising, that we're getting them gradually in and building up their stamina and their endurance. So week one, the group that we ask them just to exercise for 15 minutes. And so you're encouraged to do 15 minutes every day, of
right.
that week.
Right.
Then week 2, you go up to 25 minutes. Week 3, you're up to 35 minutes. So by week 6, they should be doing a full hour. And if they can walk a full hour, that 3-mile 5K walk is nothing. We get people, they're done in an hour, and they're
wow.
not huffing and puffing, and because they've built up their endurance and they're able to do 3 miles very easily. So that's the way that, and everybody, like we had a gentleman who was diabetic, had terrible neuropathy, nerve pain, and was in a wheelchair. But he was actually, and he did armchair exercises when he would meet with the group.
Oh, I see. Okay.
He wasn't able to get out of the chair that much. He tried, but the day of the celebration walk, he got out of his chair, he held on, and he was able to get to the half-mile point. And he asked me, could he have my half-mile sign? What we do is the day of the celebration walk, we have people every half miles, and we have a sign that says you've made it to the half mile.
Okay.
And he asked me, could he have it? That he said that meant so much to
course
him
it
that
did.
he was able to walk a half a mile. When he started, he wasn't able to do anything. And we had another woman, she was only able to do 5 minutes week 1. And she made it. She did the whole 3 miles the day of the celebration walk.
And that's worth celebrating.
Yes.
to
It
say
really-
the least.
yes.
That's worth
It
celebrating.
is.
That's why it's called the celebration walk.
That's
That's
right.
right.
Exactly.
That's right. That's
Exactly.
exactly
Stories
right.
like that just inspire and motivate you to do this. And like you said
It
early
does.
on at the beginning of the show, it's about a change of mindset. You know, you've got to change that perspective. You really do about
do.
how you address you.
do.
Yes, and it's working in a group setting.
And it's
So
working in a group
you
setting.
have people who are leading it, who want to lead it and want to help. And then you have the people who are around the table who
Of
want
course.
some assistance.
Yeah.
And sometimes people do not want to go to their, let me say, people go to their doctor, and their doctor says what? You need to increase your exercise.
I think that's everybody.
And,
Yes.
or you need to watch what you eat, lower your salt intake, and they come back saying, okay, what do I do? And they get a pamphlet, they get this, and they're like, okay, now I read this, what do I do now? Now what? This allows them the opportunity to learn some of those skills that they need, that the doctor is saying you need to do, and then do it in a more comfortable peer setting. So it's not necessarily a physician talking to them. It's their parishioner. It's their club leader.
Someone
it's their
that they
friend.
engage with regularly and that they're comfortable with.
And they work and they join together. Like Jeanne said, it may become competitive, or it may be very just comfortable and allow somebody. I didn't see you at the training this week. Are you okay? Or how's it going? Or let's meet up next Saturday. It just allows for that, and that's been the growth of it.
Is there a website that folks can visit to get more details?
Well, in Montgomery County, ours is one, you will go to our website, which is the African American Health Program's website, which is www.onehealthylife.org.
Okay.
And the information about our Health Freedom Walk is on the site.
It's on there.
Yeah,
Okay,
and
great.
then you can contact our office directly as well to, it has the information who to contact from our office. And if you would like to be a part of a walking group, meaning maybe it's not starting at your center, but you want to see if there's one nearby, we can let you know that. If you're interested in just registering for the Celebration Day walk, you can do that. Or even, it's still not too late, that if you'd like to have your own Circle of Friends group, we will be more than welcome to help you do that. And we work with Jeanne and her office, and we work with our office to say, if they say, look, I want a group now, and we'll do it, even if it's the day before the walk.
And we know those things
happen. We would still say, how about this? Sign up, and guess what? After the walk, you can keep going and do it and keep moving forward.
Exactly.
Yeah, so onehealthylife.org is our website for Montgomery County's contact.
Onehealthylife.org.
Yes.
And our website is www.healthfreedominc.org.
Healthfreedominc.org.
Yes.
Okay.
They can do, and they can actually register online. Because one other thing, we do have some people that aren't groupies, and I do find men that I hate to say,
but that's a
but
whole nother conversation.
it is. But 87% of my participants are women. We don't get a lot of men, and I do put a plea out there to the men if they would. But a lot of men don't like the groupie thing, and so if someone wants to do this on their own without, they can do that. They can register, they can get the manual, and the conductor, they would sign up under a site, and that conductor, they would just report in to the conductor about how they're doing. And if they don't want to come and meet as a group, and maybe they're already exercising and doing stuff like Heather said, but this just gives them an extra push to do more.
Absolutely.
Because maybe they want to see if they can make it to Canada, you know, and so this gives them that push. They can do that. So I don't want people to think that they have to join a group. That they can do it as an individual, or they can join the group if they want that support.
And what's the date for the actual celebration? Is it the
celebration?
celebration?
Saturday, June 13th.
Okay, Saturday, June 13th.
Yes.
And what's going to take place that day is that you walk on the Matthew Henson Trail?
That's right.
Yes.
That is amazing. I've actually walked that trail. It is absolutely beautiful.
Yeah, and even during the day, we have vendors who will be there with health information. We'll be doing screenings. We even have a gospel. The one thing that was amazing in Montgomery County was, and I've seen video of it, is that there was it the Sandy Spring?
It was
part?
in Sandy Spring. It was a legacy trail.
Yeah, and they've had a choir sing
as they're coming out of the woods,
and you can hear the choir sing. So we always have music, and we have local choirs who come and sing. Again, it's just the whole idea of the connection between the health and then the spiritual aspect of the history of the Underground Railroad.
Absolutely.
Yeah.
We also had actors, and we'll probably we have a gentleman, Frederick Douglass. He is just, I mean, you really do feel you're in the presence of Frederick Douglass. But people can have a picture made with the reenactment actors. We have, Harriet Tubman and some of those more well-known ones, but as I said, they'll learn a lot more from the manual.
Well, ladies, 30 minutes is never enough time to talk about something so important, so I hope to have you back on the show. Thank you again for coming on today's show.
Thank
really
you.
Appreciate it.
Thank you.
And Heather's already told me that I've already signed up, and I didn't realize that. Unfortunately, that's about all we have time for today. I'd like to thank my guests, Heather Ross and Jeanne Charleston. I'm Deborah Milo. Please join us again next month for another edition of MOSAIC An African American Perspective. Till next time, make it a great and healthy day.
I grew up in the housing projects of Cleveland. I didn't even know that life could be any better than it was. Education for me has been a way to get away from the agony of what was normal life. I want to be able to impact the community, not just look back on where I came from, but to reach back to where I came from and pull some people up with me. My name is David, and I am your dividend.